who can access public health. And is your visa application at risk of being declined because of this? Because that's the real question here. Let us find out in this video. Kia ora whānau, it's your girl, the sassy engineer, your favorite Niger Kiwi down under New Zealand. Today I want to talk about health as a requirement for all the Immigration New Zealand visa applications. Most people who have resident visa and live in New Zealand can access public health. People who are on a work visa, a long-term work visa, so more than 2 years, can access public health. But if you are a student, you cannot access public health. What I mean is you can go to a public hospital and get treated, but you will have to pay for your service. If you can access public health, it means that you can go to the hospital and you get subsidized rate. Right now, if you are a resident, citizen, or you're on a long-term work visa and you get prescriptions, you pay $5. So depending on the pharmacies you go to, some pharmacies you don't even pay. But if you don't have access to public fund, you're definitely going to pay money for that drug. Right? That's what I mean. GP visits too. Some people get it free. Some people pay subsidized rates. Some people pay full rates. This is for public hospitals, public health. If you're going to private, whether you're a resident or not, you are paying because it's private. Now that's where your health insurance comes in. So this is what we mean accessing public health is getting those benefits of being a citizen in the country. So subsidized GP visit, subsidized prescription drugs, and you could be eligible for full health care or limited services only, free public hospital services and support services if you have disabilities. So remember that my healthcare video that I talked about, yes, I talked about the details there. So you go and check it out to see exactly what I mean. That's a summary of everything. Let's go to the important thing, how they assess your health. Because you probably have heard that some people that have gotten medical waivers. What are those conditions to get the medical waivers? You now know that visa health requirements is very important, but how do they assess these things? How they assess your health depends on whether you're wanting the type of visas, basically. Right, so I said that they will assess your health, right, to determine if you meet the eligibility criteria for the visa, that's the health requirement, and to see that you are of acceptable standard of health, right? Remember I said that you are going to go for a medical examination, which will involve either X-ray or medical exam. So all those blood tests, blood work, BP, everything, those are the medical examinations. Urine tests, so many tests, right? They will test if you have tuberculosis, STDs, stuff like that. Those are the medical examinations. So you might need to do either or both. The results of this examination is what they will now use to decide should they continue with your application or do they need a medical opinion to decide whether you meet the visa health requirements. Now, if they need a medical opinion, medical assessor's opinion, then they may ask you for more medical information. That's when you get another email saying, we need you to go and do another blood work. We need you to go and test your whatever. We need another complete blood work test. Because maybe that day you went to do the test, you were stressed. So probably your BP was high and everything. So now you're going to be calm. Do it again, right? You understand all those things. And then whether they can continue processing your visa because the medical assessor will be like, oh, this is fine. It's normal. Tick. Or it's normal for people from their country. Tick. Continue with the application. Or to see if you are eligible for a medical waiver assessment. So sometimes it may be something that maybe, you could waive that. Right. It doesn't really meet, but it can be waived, or they decline your visa application. So, two outcomes of this assessment, how they assess it, they look at your initial result and say, okay, continue the application or get a second opinion. And then if you get a second opinion, the second opinion will now tell them, okay, we need more tests. They ask you to do more tests. We tell them, it's fine, continue. They continue, or it's not so good, but we can waive it. You waive it or decline. That's just how they do it. Everything is based on the result of your X-ray and your medical exams. If you're on a temporary visa, they may decline your visa application if because of your health you need hospitalization, you need residential care, high cost pharmaceutical, high cost disability services. They may also decline your visa application if you have severe developmental or cognitive needs. So that one is for children, because when you hear cognition, it's usually children. These conditions are varying, but they include things like physical disability, intellectual disability, autistic spectrum disorders, brain injury. So all of this applies for child of a worker visa, child of military, child of student dependent student visas. If your child has severe developmental or cognitive conditions that will require them to have significant support, then they may decline your temporary visa application. For those applying for resident visa, these are some of the conditions that can make them decline your visa application. It's a very gray area and very dicey, so you will probably require an immigration advisor or lawyer to help with that. You have hepatitis B surface antigen positive, you have hepatitis C RNA positive, and you meet criteria for antiviral treatment in New Zealand. They may decline your visa. You have malignancies of organs, melanoma, hematopoietic tissues, all the things, including if you've even had it in the past or are currently undergoing treatment. So there are some exceptions like treated minor skin, malignancies, so the length of time since treatment means like likelihood of recurring is below 10%. Then they may decline your visa if you require organ transplants and maybe you have organ transplants and you need some immune suppression. They may decline your visa if you have severe chronic or progressive renal or hepatic disorders. They may decline it if you have musculoskeletal diseases like osteoarthritis, which is very interesting. But that I think it's those that are likely to require surgery in the next 5 years. They may decline your visa if you have severe, chronic, or progressive neurological disorders, cardiac diseases, chronic respiratory diseases, significant autoimmune. So you're seeing that all these things are really tuned to very older people or younger people. And if you're in the middle still, so there is a long list of things that can cause them to decline your resident visa application. That's why it's good to be on top of these things to know exactly what can make them decline your visa. I would like to stop here to tell you that I have checked the backlog and 70% of you are not subscribed. What is happening? Click the subscribe button to join the community. Like this video because you know how it helps the algorithm. Okay, share it to people who need it. And make sure that if you have any questions, pop it in the comment section. But if you want to chat with me one-on-one, send me an email and we can book a time to do that. Okay? Let us continue. These are some of the things that can make them decline your visa, but there are also opportunities for medical waivers. But again, as you know, with Immigration New Zealand, there are conditions to this. So let us look at a situation where you will need medical waiver. And medical waiver lets them process your residence or temporary visa application if you don't meet the normal health requirements. So you're not too well, but let us waive it. Maybe it's because they've seen that even though you don't meet the acceptable standard of health, you are not going to be a burden to the public health care system. And then they will waive it. So there are many reasons why they can waive it and their eligibility criteria. So that's what it means. It just means that it lets them process your visa if you do not meet the normal health requirements. If you have an approved medical waiver, you might not need to meet the health criteria for your visa application to be approved. But you cannot apply for this medical waiver. They have to be the one to decide to give you one when they process your visa. So that's something that you need to know. It's not something that you apply for it. Otherwise, everybody would apply for it. Okay? How do they decide on giving you medical waivers? They say that before a medical waiver assessment for your visa, they check to see if you meet the rest of the visa application requirements. So apart from health, you have character, you have relationship, you have funds, you have genuine intentions, and the rest. They check out that. What support you would need from New Zealand Health Care and Education Services. So again, like I said, are you going to be a big burden on the system? Your potential benefits to New Zealand. So you as a person, what would New Zealand benefit from you? And what family you have in New Zealand. There are family in New Zealand who support you. So do you have family in New Zealand? What type of family do you have? Are they also dependent on the public health care system and many other things? These are just examples. This is not just the only condition, okay? So don't just focus on that one example. Now, your parents' contribution to New Zealand, that's if you are a dependent child of a work student or military visa holder. How long you are staying. So these are some of the examples that they use, but obviously you know that there are going to be some other things. But generally, this is what they look at for. When they can give this medical waiver, they class it under two, whether it's a temporary visa application and whether it's a resident visa application. If it's temporary, they will consider it if you are applying for a work visa as a seconded business person, a refugee or protection status claimant, have refugee or protection status in New Zealand, are a partner or dependent child of a New Zealand citizen or resident class visa. The purpose of your stay is to visit your partner and you meet the criteria of either partnership or dependent child resident visa. You're applying for a visa as a dependent of a work student military visa holder and have severe developmental or cognitive conditions that will need significant support. So there's a list of visas that can get medical waivers. Then for resident visas, a medical waiver will usually be granted for a resident visa application if you are a New Zealand citizen or residence partner or dependent child and you meet all your other visa application requirements. But they can decline your application if you need things like dialysis, you have severe hemophilia, and you need full-time care, you have tuberculosis, they hate tuberculosis. New Zealand and Australia don't even want to hear of it. And you're applying for a family category visa and you'll be eligible to be included in an earlier resident visa application, but we're not included or declared. So that one looks like something fishy was going on. So you were eligible before, why didn't they include it? Why are they not including you now? Something like that. So yeah, these are just some of the times that they can give you medical waivers. That's the gist of the matter, people. Having an acceptable standard of health is as important as proving your genuine intention, proving that you're in a stable and genuine relationship, and other visa requirements. In short, in some cases, it's the health that will trump all other visa requirements and that can lead to your visa application being declined. So I know that you need to show that you have enough money. I know that you need to show other things, but also pay attention to the health clause because this could make your visa application be approved or declined. And that's why it's important that I talk about this and break it down for you to understand. So this is just the summary of everything, what acceptable standard of health is, how they assess it, what they look out for, which as you have learned is now the impact of your health on the public healthcare system. So it doesn't matter if you have money for private. How are you going to affect the public health system in a situation if you require the public health system? And the different ways that they assess it. Now you know the importance of medical assessment. So when you're going for your medical exams, make sure that you have had a good night's sleep, you have rested, and you are not stressed. I know it's stressful, but try as much as possible not to be stressed. Be hydrated, drink lots of water before your test because all these things could trigger some stuff that will require you to do a subsequent assessment, but most likely not. So pay attention to your health because it's very important for New Zealand visa application. And I hope that I've been able to explain all these things in simpler terms for you to understand. But if you have any question, make sure that you put it in the comment section. Ask your question. Don't be shy. Okay. If you want to have a chat with me one-on-one, send me an email and we can book a time for that. Don't forget to like, subscribe, and share. And I hope that you learn a thing or two in this video and you've been able to understand how immigration assesses and decides acceptable standard of health. It's your favorite girl, the Sassy Engineer. Thanks for watching.
Anyway.